Hi friends, in this lecture we will try to cover the anatomy of the nose as well as the paranasal air sinuses. These are the specific objectives which we will try to cover. The first one is list the parts of the nose. The second is name the cartilages and the bones taking part in the formation of the nasal septum. 3. Name the bones taking part in the formation of the lateral wall of the nose. Fourth is identify the conchae as well as the myitis of the nose. Fifth is list the openings of the air sinuses within each myitis. Sixth is list paranasal air sinuses. Seventh is recognize the relationship between the teeth of the upper jaw and the maxillary air sinus. And the eighth is describe the maxillary air sinus regarding its position, shape, relations, blood supply, nerve supply as well as lymphatic drainage. Here only the maxillary air sinus is mentioned, but we will try to cover all the air sinuses. To begin with, as you know, the nose is a very important structure through which the air which we respire will enter as well as exit. Okay, so this is the nose here. So the nose is made up of two important walls. One is the nasal septum, which is also called as the medial wall of the nose, and we have the lateral wall of the nose. Okay, so the medial septum, which will separate the two parts of the nose. Okay, it is the partition which separate the two half of the nasal cavities. So the two nasal, it is dividing the whole of the nasal cavity into two parts, the right and the left. So this will at the center we have this part. This is called as the nasal septum. It is often deflected from the median plane. Usually it should be in the center in the median plane, but usually it is deflected. That is called as deviated nasal septum, and it has its own complications. Later we'll try to discuss about that. So there is a nasal septum which is not exactly in the median plane but slightly deflected either towards the right or the left, and makes each of the nasal cavity asymmetrical because it is not exactly at the center. So there is asymmetry between the right and the left nasal cavity. Most of the septum is covered by the mucous membrane except the mobile part which is covered by the skin. The whole of the inner cavity is covered by the mucous membrane except the part which is mobile part in the front, which is covered by the skin. Okay, and because of the skin there will be also the hair, nasal hair. Okay, it is formed by bones as well as the cartilages. So the nasal septum is not only bony in origin but also cartilaginous. So it has both the parts, the bony as well as the cartilages. First we will talk about the bony part of the nasal septum. So this is the bony nasal septum in the center, and on either side there will be cavity of the nose. Okay, so the bony part, it has two principal bones. The main bone, one is called as the perpendicular plate of the ethmoid bone. Perpendicular plate of ethmoid bone, this is the ethmoid bone shown in green color. So this is the perpendicular plate, and here the second bone, that is called as the vomer. So these are the two main bones which will form the nasal septum. Okay, apart from this there are some accessory bones, small bits and pieces, which will be the accessory bones which will also contribute in the nasal septum. One is called as the nasal spine of the frontal bone. Frontal bone is here and a part of it extends downwards. This is called as the nasal spine of the frontal bone. Then the sphenoidal crust as well as the rostrum itself, a part of the sphenoid bone here. This is the sphenoid bone, this is the sphenoidal air sinus. So there a part of it, sphenoidal crust and the rostrum, will be invaginating and forming a part of the nasal septum, as well as the nasal crust formed by the articulation of the palatine process of the maxilla and the horizontal plate of the palatine bone. So here if you see here, so a part of it, the nasal crust formed by the articulation of the palatine process of the maxilla. Okay, as well as the horizontal plate of the palatine. This is the horizontal plate of the palatine bone, as well as the nasal crest of the maxilla itself. Both will contribute in the formation of this small part of the nasal septum. So the nasal crest of the maxilla and the palatine bone, both the bones have been shown here. So this will also contribute slightly in the formation of the nasal septum. So these are the bony part. The main bones will be the perpendicular plate of ethmoid as well as the vomer. These are two important bones. Then there are small bits and pieces of the accessory bones. Then we have the cartilaginous part, which is the most anterior part. So this is formed by three cartilages. One is the septal cartilage. The main cartilage will be the septal cartilage itself. Then the septal process of the inferior nasal cartilage as well as the vomeronasal cartilage. A very small part here, which is called as the organ of Jacobson. Which will be mainly for the olfaction. Okay, so this will be the contribution from the nasal cartilages, mainly the septal cartilage, then the septal process of the inferior nasal cartilage. Okay, small part, and here there will be a small vomeronasal cartilage, or which is also called as the organ of Jacobson. Okay, so which will be forming the cartilaginous part. So there is bony part, which is the posterior part, behind part, and the anterior part, which is mainly cartilaginous. So the cartilaginous part is slightly mobile compared to the bony part, which is behind. Okay. Coming to the arterial supply. The arterial supply is by some 3 to 4 arteries, mainly the anterior superior part. So the anterior superior part here will be by the anterior ethmoidal branch of the ophthalmic artery. So the septal branch of the anterior ethmoidal artery will be supplying the septal part of the nose. Okay, so or the anterior ethmoidal branch of the ophthalmic artery. Okay, so then we have the posterior inferior part, which is below here, as well as inferior, posterior as well as below, which is supplied by sphenopalatine and greater palatine branches of the maxillary artery. The septal branches of the sphenopalatine artery has been shown, as well as the greater palatine branch of the maxillary artery. Both will be supplying this whole part, which is posterior and inferior. Now, mobile part, the most anterior part, will be supplied by the septal ramus of the superior labial branch of the facial artery. A small branch from the facial artery, that is the septal branch from the nasal artery, from the superior labial artery, which is a branch of the maxillary artery, which will be supplying here the mobile part. So these are the 4 arteries which will be supplying most of the parts of the nasal septum. And there is a very important clinical area which is clinically important, that is called as the Little's area, or it is also called as the Kesselbach's area, which is important in case of epistaxis, that is the bleeding from the nose. A point of the antero-inferior part of the septum, where the septal branch of the facial artery, the long sphenopalatine as well as the terminal branch of the greater palatine artery is anastomose. So here this is the area somewhere here where the 3 arteries, the septal branch coming from the superior labial artery, then the long sphenopalatine branch as well as the greater palatine branch, all will be anastomosing in a particular part here. So that is called as the Little's area, or it is also called as the Kesselbach's area. So what is the importance? Even a slight trauma leads to profuse hemorrhage from this part. So this is a very important area which is highly supplied by a lot of arteries. So where the anastomosis of all these 3 arteries will be taking place, and it is highly vascular area, and even slight trauma will lead to severe bleeding from this part. Okay, so this is called as the Little's area. Coming to the venous drainage. So the venous drainage is by 4 important veins. One is from the anterior superior part by the superior ophthalmic vein. Superior ophthalmic vein will be here, so it will be draining into the cavernous sinus later. Okay, so this is the superior ophthalmic vein, which will be draining most of the upper part as well as the anterior part of the nasal septum. Then posterior inferior part will be directly drained into the pterygoid venous plexus. This is the pterygoid venous plexus which is shown here. So it will be draining into pterygoid venous plexus. Then the mobile part of the septum, that is the most anterior part, into the jugular internal jugular vein. Okay, sometimes via deep facial vein to the cavernous sinus also. That's why it is called as the dangerous area of the face, the most anterior part of the nose and the upper lip. So that whole area, this area will be called as the dangerous area, and it is usually draining into the internal jugular vein, sometimes into the deep facial vein, from there to the cavernous sinus directly. Okay. So that's why the infection outside will go into the cranial cavity and from there to the brain. So that's why it is called as the dangerous area of the face. Okay. The upper part of the septum into veins accompanying the olfactory nerves and drain into the inferior cerebral veins. From here also, the most upper part, it will be close to the olfactory nerves, which are passing from the cribriform plate of the ethmoid bone into the nose. From there will be small veins which will draining into the inferior cerebral veins, into the superior sagittal sinus through the foramen cecum. Okay, so it might drain into the cranial cavity itself. So this is the drainage of the whole of the nasal septum. Okay. So here they have shown you the anterior superior alveolar artery as well as the vein, and here they have shown the posterior superior alveolar artery and the vein, and they are all draining into the cavernous sinus or into the pterygoid venous plexus or into the internal jugular vein deep inside. This is the external jugular vein they have shown. So here will be the internal jugular vein. So here they have shown the inside. So this is the internal jugular vein. They will be draining into either into internal jugular vein or into pterygoid plexus or into the cavernous sinus itself. Okay, so this is about the venous drainage. Coming to the lymphatic drainage, the lymphatic drainage, again it is divided into anterior part, which will be draining into the submandibular lymph nodes. Okay, so it will be draining from the anterior part of the nasal septum, draining directly into the submandibular group of lymph nodes. The intermediate as well as the posterior part will be draining into the retropharyngeal group of lymph nodes, and the upper part into the CSF, the most upper part near the cribriform plate, into the CSF through the lymphatics accompanying the olfactory nerves. The olfactory nerves, along with them, they also carry some small veins as well as the lymphatics, which will be draining into the cranial cavity. So even the lymphatics of the upper part will be draining directly into the CSF, because there are no lymphatics within the cranial cavity. So they will drain into the CSF. So this is the lymphatic drainage of the nasal septum. Anteriorly into the submandibular group of lymph nodes, posteriorly into the retropharyngeal group of lymph nodes, and the most superior part into the cranial cavity itself. Coming to the nerve supply of the septum, the nerve supply. So this is the cribriform plate, and in the cribriform plate there are small holes through which the nerves will be coming here. Okay, these are called the olfactory nerves, or the branches, septal branches of the olfactory nerve. Okay, the first cranial nerve. So this will be mainly for the sensing of the smell. Okay, by 15 to 20 bundles of olfactory nerves which will convey sense of smell. Okay, along with these nerves, we were talking about the small veins which might be draining into the cranial cavity, as well as the lymphatics also draining into the cranial cavity through the small holes through the cribriform plate. Okay, then the second is the anterior superior part. Will be supplied by the anterior ethmoidal branch of the nasociliary nerves. The most anterior part will be draining will be supplied by the anterior ethmoidal branch of the nasociliary nerves, the septal branch of the anterior ethmoidal nerve, which they have mentioned here. Then the intermediate part, long sphenopalatine branch of the pterygopalatine ganglion from the maxillary nerve, that also supplies. The posteriormost part will be by the short sphenopalatine nerve of the pterygoid canal, as well as nasal branches of the great palatine nerve. Then the anterior inferior part by the anterior superior alveolar nerve, and the most mobile part, most anterior part, will be by the external nasal nerves. So all these nerves will be supplying the nasal septum itself. Now coming to this was all about the nasal septum. Now coming to the lateral wall of the nose. On either side there are lateral walls which will form the roof or the lateral wall of the whole of the nasal cavity on either side. So if you see the lateral wall, this will be, it will not be smooth, it will be like this, okay, with elevations and depressions. So what are these? So it has three nasal conchae. So there are three nasal conchae. So this is the superior, this is the middle, as well as inferior conchae. Concave means elevations which are seen here. Okay, then below, space below the conchae is called as the meatus, the space which is below this conchae. Okay, so it is curved and below that there are spaces. So these spaces are called as meatus. Okay, so there are conchae which are elevations from the lateral wall, and below that concave there are spaces. These are called as meatus. Hence there are three nasal meatus: superior, middle and inferior. So with the space below the superior concave will be called superior meatus. Superior concave will be called as the superior meatus. The space below the middle concave will be called as the middle meatus. The space below the inferior concave will be called as the inferior meatus. So superior, middle as well as inferior meatus, and these are the concave elevations. Okay, so here you can again see this has been the picture has been broadened so that you can appreciate the concave, the three concave, as well as the meatus space below these concaves. Okay, the openings in the lateral wall of this nasal cavity. So now we should know there are many openings within this lateral wall. So what are these openings within this lateral wall? So as we have seen, there are three concave and three meatuses. Okay, so there are meatuses are the spaces. So within the meatus there will be openings. So now let's see what are these openings within the meatuses. Okay, above the superior concave, this is the superior concave. Above the superior concave, there will be opening of the sphenoidal air sinus. This is the sphenoidal air sinus. So it will be directly opening above the superior concave. Okay, so above the superior concave, it will be opening. Okay, then into the superior meatus. Superior meatus is below the superior concave. So there will be opening of the posterior ethmoidal sinus, ethmoidal air sinus. Okay, so then we have the openings within the middle concave. So the middle concave has been cut so that you can appreciate the openings there. Okay, so there is an elevation within the middle meatus that is called as the ethmoidal bulla. Ethmoidal bulla. This is because of the presence of the ethmoidal air sinus deep to that. So that's why it gives an elevation. This is called as the ethmoidal bulla. Okay. Along with this ethmoidal bulla, there are openings here. Which are those openings? One is the opening of the maxillary air sinus. Opening of the maxillary air sinus. Okay. We'll see all these air sinuses later. Just remember the names. Later we'll see these sinuses. Okay. So the maxillary sinus is within the maxilla on either side. So that will be opening into this middle meatus below this bulla. Okay. Then the opening of the middle ethmoidal air sinus. Middle ethmoidal air sinus will be opening above the bulla, and anterior to that will be the opening of the anterior ethmoidal air sinus. Then also there is opening of the frontonasal duct. Frontonasal duct will be also opening into this middle meatus. Okay, so these are the openings. So there are very important openings within the middle meatus. In the superior meatus there was only one opening of the posterior ethmoidal air sinus, but in the middle there are many openings. One is the elevation of the ethmoidal air sinus itself, that is called as the ethmoidal bulla. Along with that, the openings for the maxillary air sinus, the anterior as well as the middle ethmoidal air sinus, as well as the frontonasal duct also. Okay, then opening into the inferior meatus, that is below the inferior concave, which is this is the inferior concave cut, so that you can appreciate the opening of the very important opening that is called as the nasolacrimal duct. Nasolacrimal duct. Okay, so from the eyes directly, the nasolacrimal duct will open into the inferior meatus. Okay, so there is one opening in the inferior meatus, there is one opening in the superior meatus, one opening above the superior meatus, but there are three important openings into the middle meatus. Okay, that you should remember. 3 or 4 also sometimes, even the anterior which is slightly, even though it is anterior opening, but still it is considered part of the medullary meatus. Okay, so all these are the openings within the lateral wall of the nasal cavity. Now let's study the paranasal air sinuses. They are air containing bony spaces around the nasal cavity lined by respiratory epithelium. So that's why they are called as paranasal air sinuses. Para beside the nasal cavity. So that's why they are paranasal sinuses, and they are air sinuses because they contain air. So try to differentiate these sinuses from the sinuses which are present within the cranial cavity. Those are called as dural venous sinuses because they contain venous blood and they are within the dura mater. So those are different from the paranasal air sinus which are present in the bones of the face. Okay, these are nothing but the air containing bony spaces around the nasal cavity, and they are lined by respiratory epithelium, that is the serrated columnar epithelium. So we can say they are an extension, offshoot of the nasal cavity itself. They are extending from the nasal cavity. What is their function? We'll come to that later. They are rudimentary at birth, except the frontal sinus. Then they start developing during the secondary dentition, that is 7th or 8th year, and they are well developed after puberty. Okay, so only after puberty they are well developed, and usually they are absent at birth except the frontal air sinus. Okay, so these are the air sinus, okay, which have been shown. This is the nasal cavity. Around this nasal cavity they are air sinuses. So they are arranged in pairs and they are of 4 types. The first one is called as the frontal air sinus, which is present in the frontal bone. These are the frontal air sinus. So they are in pairs. Then we have the ethmoidal air sinus. In the ethmoid there are 3 air sinuses within each, the anterior, middle as well as the posterior, which are again in pairs on either side. Then we have the maxillary air sinus within the maxilla, the bone of maxilla, that is the upper jaw, and we have the sphenoidal air sinus within the sphenoid bone, and ethmoidal air sinus within the ethmoid bones. That's why depending on which bone they are present, they are named accordingly. Okay, so they are frontal air sinus, then the ethmoidal air sinuses, sphenoidal air sinus, as well as the largest one, which is the maxillary air sinus. Okay, here you can appreciate again these sinuses. The frontal air sinus has been shown in the frontal. This is the frontal bone. Within the frontal bone, they are the frontal air sinuses. The maxillary air sinus within the maxilla. This is the maxilla bone on either side. Within the maxilla, they are maxillary air sinuses. Then we have the ethmoidal air sinus within the ethmoid bone, and the sphenoidal air sinus behind within the sphenoid bone. Okay, so that has not been shown here, sphenoidal air sinus, but it will be behind. When you take a section, at that time we will see. Okay, coming to the functions. What is the function of these paranasal air sinus? Why they are present? Okay, the first and the foremost is air conditioning chamber. They act as the air conditioning chambers. Whenever we breathe in the air, okay, so they are conditioned, okay, and the humidity is added, as well as the temperature will be maintained. If the external temperature is higher than the body temperature, then it will try to reduce, and if the external temperature is lower than the body temperature, then it will increase the temperature. So that's why they regulate the temperature as well as add humidity to the inspired air, so that it doesn't go inside the lungs and the respiratory air passage and damage. Okay. The second is resonating chamber. They act as the resonating chamber, production of sound. So whenever we sound, the sound is produced, it will be resonated. So because these are cavities, air filled spaces, they just resonate just like an empty room, big room, and if you scream there, the sound will be resonating. Similarly, whenever we speak, at that time the sound, along with the air, the sound which will be coming, it will be resonated, and it will be produced as a good quality sound. Okay, so the sound is resonated by these chambers. Then the facial bones are lighter because of these spaces within these bones. the large spaces. So this will lighten the bones of the face. They help in the lightening of the facial bones. Okay. Then the fourth one is the mucus secretion. Along within these chambers, because they are lined by epithelium, ciliated columnar epithelium, and they have lot of, along with the ciliated epithelium, there are a lot of mucus secreting cells within them. Okay. And this will be secreting mucus. This is important, especially during if there is any infection of these sinuses, especially the maxillary sinus, which lead to lot of complications if there is excessive production of the mucus. Okay. So these are some of the functions of the paranasal air sinus. First is they acts as the air conditioning chambers. Okay, by adding the humidity as well as regulating the temperature. The second is they help in resonating of the sound which you produce. The third is it lightens the facial bones, and the fourth is they secrete mucus secretions. Okay. Coming to the first and the foremost, that is the maxillary sinus, the largest one, which is the maxillary sinus, which is present within the maxilla. This is the large maxilla. Okay, which is the upper jaw. Within this upper jaw there is a big cavity around the nasal cavity. See this, all these sinuses are around the nasal cavity, and the largest one, the maxillary sinus, is beside the nasal cavity on either side. Okay, so they are the largest of the paranasal air sinus, present within the body of the maxilla and roughly pyramidal in shape. If you see, they are almost triangular in shape or pyramidal in shape. Okay. Okay. So if you take a section here, so this is how it looks like. Beside the orbit, this is within the maxilla, we can see the maxillary air sinuses. Okay, on either side. This is the nasal cavity, this is the nasal septum, this is the nasal cavity, these are the concha. So this is the inferior concha, middle superior concha. Okay, and here is the middle concha within to which the maxillary sinus will open. Okay, so they are the largest of the paranasal air sinus, the maxillary sinus, present within the body of the maxilla and roughly pyramidal in shape. The size almost 3.5 centimeters into 2.5 centimeters into 3.25 centimeters length, breadth, as well as the width. As you know that the maxillary air sinus is triangular in shape or pyramidal in shape, as you saw it. It has an apex as well as a base. The apex is directed towards the zygomatic process of the maxilla. Here is the zygomatic process, so it is directed toward this is the apex of this maxillary sinus. This is the apex. Then the base is toward the nasal surface of the body of the maxilla. So the base will be here toward the nasal cavity, nasal surface of the body of the maxilla. Here is the apex and here is the base. So here you can appreciate this is the apex and the base is toward the nasal cavity. Okay, then the roof is toward the orbital surface of the maxilla. This will be forming the orbital surface of the maxilla, that will be forming the roof. This is the roof, and the floor will be here. So here will be the floor. The floor will be the alveolar process of the maxilla. Here is the floor itself. So that will be by the alveolar process of the maxilla. So this has an apex, a base, roof, as well as the floor. So this is the apex, this is the base, this is the roof, and this is the floor. Okay. The anterior wall is related to the infraorbital vessels as well as the muscles of the upper lip anteriorly, and the posterior wall bound by the boundaries of the infratemporal as well as the pterygopalatine fossas. Then the opening of this maxillary air sinus is into the middle meatus, into the middle. This is the middle meatus, which is just below the middle concha. This is the middle concha. So just below the middle concha, below the ethmoidal bulla. So here will be opening of the middle meatus, drains into the middle meatus through the floor of the hiatus semilunaris. Hiatus semilunaris, let me show you later, is just below the bulla. So there is a circular structure that is called as the hiatus semilunaris, just below the bulla ethmoidalis. Okay, so it will be opening here into the middle meatus. So this is the opening of the maxillary sinus. Okay, so this is all about the maxillary air sinus. Coming to the blood supply of this maxillary sinus by the anterior, middle as well as posterior superior alveolar vessels. Here they have shown you the anterior superior alveolar vessels. Here is the posterior superior alveolar vessels. All this as well as the middle superior alveolar vessels. All will be will be supplied by the maxillary vessel. So this is a maxillary artery which will be supplying this. The anterior, middle as well as posterior superior alveolar arteries will be supplying. Then the venous drainage will be by the similar names, anterior, middle as the posterior superior alveolar veins, which will be draining into the maxillary vein. Okay, coming to the lymphatic drainage, it will be into the submandibular group of lymph nodes here, and the nerve supply will be from the anterior, middle as well as posterior superior alveolar nerves, branches of the maxillary as well as the infraorbital nerves. This is the nerve supply. So as you have seen, this is the maxillary sinus. This is the X-ray showing you all the air sinuses. These are the maxillary sinus, and here you can see this is the frontal air sinus. Here are the ethmoidal air sinus, and the sphenoid air sinus cannot be seen with this view. Okay. Coming to the frontal air sinus, this is the frontal air sinus on either side within the frontal bone. They are paired and present within the two tables of the squamous part of the frontal bone, deep to the medial end of the superciliary arches. So here will be the superciliary arches. Deep to that on superciliary arches, deep to that will be the frontal air sinus. So here you can see this is the frontal bone. Within the two tablets of the frontal bone, you can see this is the frontal air sinus. Okay. So they are paired and present within the two tablets of the squamous part of the frontal bone, deep to the medial end of the superciliary arches, as I showed you. They are triangular in shape. Again, they are also triangular in shape, as you saw here. So they are also triangular in shape, similar to that of the maxillary sinus, but they are smaller. They are triangular in shape and asymmetric. Okay, they are not symmetrical, but asymmetry. Vertical, the size vertically it is 3 cm, transverse is 2.5 centimeters, and the anterior posterior diameter is 1.8 centimeters. And this will be opening into the middle meatus through the ethmoidal infundibulum and hiatus semilunaris. Okay, so along with the maxillary sinus, this frontal air sinus also opens through the middle meatus. Blood supply is by the supraorbital vessels, the artery as well as the vein. Lymphatic drainage will be into the submandibular group of lymph nodes, and the nerve supply will be by the superior orbital nerves. So here will be the superior orbital artery, vein as well as the nerves. Everything will be supplied by the same supraorbital vessels as well as nerves. Okay. Now coming to the second one, ethmoidal air sinus. So ethmoidal air sinus within the ethmoid bone, so present between the medial wall of the bony orbit and the lateral wall of the nose. So it is present between the orbit and the lateral wall of the nose. So the medial wall of the orbit and the lateral wall of the nose is formed by the ethmoid bone. So this is the cribriform plate of the ethmoid bone. This is the horizontal, this is the cribriform plate, and this is the crista galli of the ethmoid bone. This is the cribriform plate of the ethmoid bone, and this is the perpendicular plate of the ethmoid bone. And these are the spaces where the ethmoidal air sinus will be present on either side. Okay. So present between the medial wall of the bony orbit and lateral wall of the nose. Between the orbit and the lateral wall of the nose will be present. These are the ethmoidal air sinus. They are present within the labyrinth of the ethmoid bone and variable in number. Okay, between 3 to 18, and thus they are grouped into anterior group, middle and posterior group. Within each group they are multiple. They are not just 3, but they are more than 3. Okay, so they are grouped into anterior. Those which are present anterior, they will be called anterior. They are which are present in the middle, they will be called as middle, and which are present in the posterior, those are called as posterior. So they are not one single, but they are in multiples. The anterior group will be usually in the number of 3 to 7 small air sinuses, open into the middle meatus through the ethmoidal infundibulum and hiatus semilunaris. This anterior group also opens, as even the middle group also opens into they are usually present in 1 to 3 numbers of these sinuses, and form the bulla ethmoidalis, as you can see here in this picture. So the bulla is formed by the middle ethmoidal air sinuses. Okay, so this elevation within the lateral wall of the nose, the bulla, is formed by the middle ethmoidal air sinus and drain into the middle meatus on or above the bulla. They open on or above the bulla. Okay, so the middle as well as the anterior group open into the middle meatus, but the posterior, usually which is present from numbered from 1 to 11 sometimes, okay, opens into the superior meatus. Okay. Coming to the blood supply, the anterior and posterior ethmoidal branches of the ophthalmic artery will be supplying, and the lymphatic drainage will be into the submandibular as well as even to the retropharyngeal group of lymph nodes. Especially the posterior one will be draining into the retropharyngeal group of lymph nodes. Okay. Now coming to the last one, that is the sphenoidal air sinus. Sphenoidal, this is the frontal air sinus. This is the sphenoid bone. Within the sphenoid bone, this is the sphenoidal air sinus, which is opening above the superior concha. Okay. So the sphenoidal air sinus, they are paired and present within the body of the sphenoid bone, above and behind the nasal cavity. So this is the lateral view of the sphenoidal air sinus. This is the anterior view of the sphenoidal air sinus. If you take a section, so this is the sphenoidal air sinus which are present on either side. Okay. And they are very important relation. We will talk about that. Openings, this sphenoidal air sinus, as I said, will be open into the sphenoethmoidal recess in the superior meatus. Above the superior meatus, there is a recess within which this sphenoidal air sinus will open. Blood supply is from the posterior ethmoidal vessels, and the lymphatic drainage will be into the retropharyngeal group of lymph nodes because they are behind, and the nerve supply from the posterior ethmoidal nerves and the orbital branch of the pterygopalatine ganglion. Okay, so this is about the sphenoidal air sinus. The most important will be the relations of the sphenoidal air sinus. As you can see, it is present behind the nasal cavity within the sphenoid bone. This is the sphenoid bone, and within the sphenoid bone, this is the ethmoidal air sinus, the sphenoidal air sinus, and opening into the superior recess above the superior concha. So it is behind the nasal cavity, and there are very important relations beside this sphenoidal air sinus. So superiorly, if you see here, it is the pituitary gland which is present on the top of it. Okay, and above that will be the optic chiasma, and below that will be the pituitary gland. Okay, then beside this sphenoidal sinus, there are the dural venous sinus here. Okay, the cavernous sinus on either side. This is the dural venous sinus on either side. Very important sinus, cavernous sinus, which will be mainly draining most of the part of the brain itself, as well as the cranial cavity. So this venous drainage to from all the parts, most of the parts of the brain as well as the cranial cavity will be into the cavernous sinus. So this cavernous sinus on either side will be present beside, on the lateral side of the sphenoidal air sinus. This is the cavernous sinus. Along with that, there are also very important structure within the sphenoidal air sinus. One is the internal carotid artery, then the third cranial artery, the cranial nerve, the third cranial nerve, that is the oculomotor nerve, then the fourth, the trochlear nerve, then we have the fifth nerve, cranial nerve, that is the trigeminal nerve, the ophthalmic as well as the maxillary division of the trigeminal nerve. The mandibular will not be there, but the ophthalmic and maxillary divisions of the trigeminal nerve will be present here. Okay, even the abducent nerve, this is the abducent nerve, which will be the sixth cranial nerve. All these nerves are beside it, as well as the cavernous sinus. Above we have the pituitary gland, and above that will be the optic chiasma, and above that will be the diaphragmatic sella. Okay, all this will be there. So very important relations of the sphenoidal air sinus will be very important structures around the sphenoidal air sinus will be there, and they have a very important relation. Okay, so this is all about the sphenoidal air sinus. Coming to the last part, that is the applied aspects of the nose as well as nasal cavity. The first one, the most commonest, will be the DNS, that is called as the deviated nasal septum. The septum of the nose As I said, it will not exactly will be at the center, but it is slightly deviated. Normally it is slightly deviated, but sometimes because of trauma and other something or some accidents or something like that, that deviated nasal septum will lead to a lot of respiratory problems, and that leads in turn to the infections of the air sinuses themselves. Okay, so if they become chronic, then it leads to a lot of complications. So usually they do the submucosal resection of the septum. So the cartilaginous part will be cut and removed so that these respiratory problems are solved. But usually it leads to other complications. Okay, that you will study when you go clinical into the clinical years. The second is the epistaxis, that is the bleeding of the nose. Okay, so this will be as we have already seen, it will be from the little's area where three arteries will be communicating with each other, or anastomosing, which is also called as the Kesselbach's area. So epistaxis is common at this region. Okay, so the very easy way, as soon as there is bleeding, the lame person, usually the common people, they will be afraid that there is severe bleeding, and it is very easy to stop this epistaxis. Just apply pressure on this little's area, and that leads to stoppage of the bleeding itself from the nose. Okay, the third is infections, especially coming to the air sinus. As we said, if there is deviated nasal septum, or sometimes directly the sinuses get infected. The most commonest will be into the infection of the maxillary sinus, or sometimes secondly the frontal air sinus, which get infected. The most commonest will be the maxillary sinus infection, and if it becomes chronic and it is very difficult to treat with antibiotics and other thing, then they go for surgery. And there are two kinds of surgeries where they do the antron puncture itself, or there is also called the Cadwell's luck operation, through which they try to drain the excessive production of the mucus within the maxillary sinus. Coming to the fourth part, that is the carcinoma of the maxillary sinus is common compared to the other air sinuses, and usually it arises from the mucus lining of the air sinus. If there is chronic infection, continuous irritation, that can lead to carcinoma of the maxillary sinus itself. So this is all about the nose as well as the air sinuses, all the paranasal air sinuses which are beside the nose. So if you have any doubts, you can write to me and I will try to answer. Thank you very much. Hi friends, if you like my video and if you want to see similar kind of videos in the future, subscribe to my channel as well as like the video. Press the bell icon so that you can get regular updates and you will be the first to get the updates. Then you can also comment as well as share this video with all your friends so that all can benefit from this. Thank you very much.